So this is OpenEMR. We've seen this before. Let me just refresh because that's cached. So just to see what it looks like now, we're loading in the info. This is new. At the top, we see some basic info like 58 years old, female, time of the appointment, reason for the appointment. If we click into this, we actually see a lot more. If we click any of these things, the sidebar comes up, and as we said before in week one, the sidebar is actually coming from the database. These labs are high, neutral, low. So ignore that this doc is already in there. So yeah, this works like it did before. You can click these things and you could see a little bit of the information, which you know that it's not being hallucinated because this is coming from the database. We can move the shelf a little bit. So what's new? Well, first, let me ask for guidelines. So this is going to take a minute, search in clinical guidelines. So we're actually saying what we're doing because it takes a little longer now that we're doing the RAG. So this will actually go to the back end, go to this little Python sidecar we have, and look up information according to clinical guidelines and then return some of that. And then these are in purple and we can see these here. So ADA 2025 10.1 clinical guideline. So statin therapy is recommended for all patients with diabetes age 40 to 75. That fits this patient. And just, you get some information you expect there. We still have these things. So we still have, our problems, cholesterol, lab results, prescriptions. So that's how that works. We can still ask follow-ups if we want to. We still have the same protections, saying things like, if we tried to ask for another patient, it wouldn't work. So let's try and upload a file now to see how that works. Lab report, I'm going to upload this lipid panel. I'm not sure if you can see that part. So it's going to take a minute. And then it's saying, here's all these updated values. Cool. So first, you'll see that immediately it says analyze the uploaded lab report, etc. While it's happening, I'll show you here. So these values have actually gotten updated. Cholesterol was a different value. It gets a little confused. So cholesterol comma total and cholesterol total, that's a little bug in there. But really, the new cholesterol should be overwriting the old cholesterol in terms of only seeing the latest labs. And this works to some extent, but as you can see, there's still some issues. What did we get here? So lab review, these are all the values. As you see, I can click them, learn about them. It's all in the database. We're seeing that things have been going up. One thing went down or is below threshold. High risk of hypertension, etc. And then once again, we have these clinical guidelines. Note the combination of uncontrolled lipids, right? And then we could, what follow-up is needed? What are treatment recommendations? Let's just see what that is. I'm probably going to take too much time here, but as you see, it takes a fair bit longer compared to the first prompt now that we include the clinical guidelines thing. Maybe I'll just let that go. Nope. I can make specific clinical. So it is saying it can't make specific clinical decisions importantly, but it can, point out these various guidelines. I just wanted to show you some of the architectural diagrams. You should be able to see this. So we start in the browser and React. Ultimately, that talks to this PHP layer. All of this is what was happening before in week one, ultimately talking to the OpenEMR MySQL database. And then there's this sidecar thing where when someone tries to upload something, we have the upload in PHP. And also when someone makes an agent query, we talk to this side. We talk to or depending on the chat, we talk to this sidecar. This is a Python service that's only available from our PHP server. You can't actually access it, like it's internal only. You can't access it any other way. Query, ingest. So there's two important paths here. The LangGraph supervisor takes care of that, but basically some things need extraction, some things need evidence. When we get information, we have to look for the evidence to understand about the guidelines, and that stuff's happening in this RAG layer. We use Cohere for ranking. And then separately, needs extraction is the first step of when we give it a PDF, it's actually going to look through the PDF, and there's two possible routes it can take. One is the simplest route, which it just uses PDF Plumber because sometimes that's good enough, but we have a little thing kind of saying like, oh, we were 80% successful, or we just have a way of telling whether it was enough to use this pure OCR PDF Plumber thing. And if not, we send it to the agent. And we actually send it to Claude for image recognition, Claude Haiku vision extraction. Decided to use Haiku just because it's cheaper, and in terms of the examples we have, we're not using any handwritten text. It's all printed text. But if we wanted to include handwritten doctor's notes, we might want to upgrade to Claude Sonnet for this. And then all of that eventually comes back to the user here, and then we'll see that over here. Great, that's it. That's the presentation. Let me end this. How long did I go? 5 minutes. Okay.